and welcome to Beauty and the Biz, where we talk about the business and marketing side of plastic surgery. I'm your host, Catherine Maley, author of Your Aesthetic Practice, What Your Patients Are Saying, as well as consultant to plastic surgeons to get them more patients and more profits. Now, today's guest is Dr. Lauren Umstattd. Now, she's a facial plastic surgeon who grew up in Kansas City, completed a majority of her training at the University of Missouri, where she graduated with honors, and she did a fellowship with renowned facial plastic surgeon, Dr. Philip Langston, who I've known for a long time in Tennessee. And then she returned to Kansas, where she bought land straight out of fellowship, bought land and built out her own practice from scratch, also while raising a family with her husband. Now, I had Dr. Umstattd on Beauty and the Biz back in February of 2022, so it's been almost 2 years since we've talked, and I wanted to check back in with her to see how things were going. So Dr. Umstattd, it's a pleasure to have you back on Beauty and the Biz. Thanks for coming back.
Thanks, Catherine. Yeah, excited to follow up and relay some of our triumphs, but probably mostly struggles, and maybe help out a few folks out there who are listening and thinking about opening their own practice someday soon.
Absolutely. So where we left off was you had, and I saw some great photos because you were doing a really good job on social media, and you were showing the land that you built in Kansas City, and then you were building a building on it. Pick it up from there. What happened?
So I thought about buying somebody's practice and it just didn't work out. So then we ended up buying land, building a building. The building itself is a clinic and an ambulatory surgery center. So it was a big undertaking right out of fellowship. The whole process took about 2 years, from land purchase to building design to building construction to actually opening. We opened about a year and a half ago, and some things have been easier than I expected, and some things have been quite a bit more challenging than I expected.
Let's start with the easier.
I think patient volume has increased more than I probably anticipated it to. When I first sat down with the bank and did projections in terms of line of credit and how much money I was going to need to get up and going, I was very conservative with my estimates. I said, if I literally see one patient my first day, 2 patients, a day my first week or my second week in business, and then I slowly grow. If we grow 2% a month, 2% growth is slow, but also I'm a brand new business. I have no reputation, no name in Kansas City. I'm a brand new surgeon with really no before and afters. And so when I sat down with the bank, I said, this is our 2% growth, month over month. And I think we will be breaking even around year 3, based on all the operating expenses that I have with this huge new building. We're now about a year and a half in, and volume wise, in terms of patients, with clinic patients, so injectables and non-invasive stuff, and surgically, has grown more than I thought it would, definitely more than 2% a month. We just sat down and looked at the last 4 weeks, and compared to last month, I grew 7.5%. So
are you doing recon and cosmetic, or what's your ratio there?
100% cosmetic.
Oh, good for you. All right. So let's go back to the building, because I don't want to gloss over that, because it's a really big deal to build what you were building. What's the square feet, and how big of a deal were the permits and getting accredited? What was that landmine all about?
I will say some things it's best not to know how complex they're going to be before you dive in, because otherwise you would have never dove in. That is how I feel in retrospect. Am I glad I did it all? Yes. But was it incredibly complex and difficult? Yes. So the building itself, which I have our whole layout and every tiny little nook and cranny, I designed with the architects. So if anybody listening wants a blueprint, you can just email me and I'm happy to send it along. There are a lot of things in our building that I absolutely love that we did layout wise. The state of Kansas is quite strict when it comes to surgery center licensing. And for instance, my operating room is huge. I do not need as big of an operating room as I had, but that was the minimum square footage required by the state of Kansas for an ambulatory surgery center with an operating room. So in total, our building is just under 7,000 square feet. About half of that is a clinic, and half of that is an ambulatory surgery center. My ASC has one operating room, two bays that we use as pre-op and PACU. We have an anesthesiologist that comes in. She's a contractor, 1099, that just comes in for cases. We're pretty strict in terms of who we take since it's an outpatient surgery center, but she is wonderful at providing all of our sedation needs. Um, and then the clinic doesn't really require as much oversight. So that was a little bit easier to get up and running. But the surgery center, just in terms of equipment alone, you don't, as a surgeon, you kind of think like every little piece of equipment that is required to have a successful surgery, but even down to the different sizes of IVs that I need to stock in our supply closet. And I did it all essentially from scratch. I didn't have really not really. I didn't have a consultant that I used. I took the approach that I want to do it all myself, one from a financial reason, but two from an understanding reason. I think when you hire a consultant, you somewhat dedicate some brain space and understanding to that individual. Whereas I, from the ground up, I wanted to have an intricate understanding of every single regulation I had to follow, every single piece of equipment I had to have. So every state's different, like I mentioned. In Kansas, there's no certificate of need, but I do have to be licensed by the state. And so the licensing exam took place in several pieces. They reviewed my blueprint before we started construction. They had to approve that. Then they came out at 50% completion and did a partial inspection of our surgery center and had to approve that. And then their 100% completion inspection was once everything is fully stocked, ready to go, my staff is trained, essentially the day preceding a surgery. And so everything has to be in its perfect spot. And there was a significant delay on my end. I had a whoopsie. I didn't quite understand the process of ordering controlled substances, keeping them on site, and having them available for administration. That is very different than a DEA license where you just prescribe patients postoperative pain meds or fill in the blank. So to have the ability to order controlled substances to store on site and administer there in your building, it's a whole separate system. That obviously is a very highly regulated system. And that delay on my knowledge end took about 2 extra months to do all those applications, to get all the medications on site, to have them inventoried in their home where they live in our building before the state would come out and inspect everything and it'd give me my license. And then after we got our license, then I started seeing surgery consults. And so it was about another month or 6 weeks after that before our first surgery.
Wow. How did you go over budget and over time, or how far off were you from what you thought it was going to cost and how long it was going to take?
For the building, we went over budget by 100%. So it doubled. That was somewhat related to the construction costs related to COVID shortages with materials and construction personnel. And timeline wise, we were also over. The builder told me it'd take about 6 months, and it took 14 months. So it was more than double.
Whoa.
Which, you just kind of got to roll with the punches. I think in during the time, I was really nervous. I was like, gosh, I should be seeing patients. I should be operating. This is like a gap that I don't want to take. But in retrospect, I think it was a really good amount of time that I was able to spend on the actual business, dedicating to equipment purchase, staff hiring, getting ready for staff training, creating my brand, and really honing in on exactly how we were going to deliver the best possible care that we can to every single patient that comes in our door. So, was it a little break in seeing patients? Yes. But in the end, and some of that overlapped with fellowship, it wasn't a full 14 months. But I think in the end, it actually provided a good breather after training. I had our second baby at the time, which was great to be able to spend time with him. And then really being able to dedicate a lot of brain space and time to the business component, which, as you know, requires a huge amount of time and expertise.
At least you had that freedom to have that time. Like you weren't on the clock and somebody was waiting for a paycheck, you know? But how did you hire staff not knowing when the doors were going to open? How did that work?
I got really lucky. My first few team members, I was totally upfront with them. I said, I want you to be my ex, my nurse, my patient coordinator, my anesthesiologist, but I'm not exactly sure when we're going to open. And so these women basically just kept their jobs until I told them where to go. And so, for instance, our patient coordinator, she kept in her current position and she said, I want a 4-week notice before you think we're actually going to open and I will start working. So then she gave her job a 2-week notice, took 2 weeks off, and then started with me. So I was very open in terms of communication when we were recruiting one another and talking about the position, as well as during the whole process once they agreed to come on and join our team. So I think the amount of faith, I thought about this the other day, the amount of faith that these women put in, kind of my dream and this whole process is really incredible because they didn't know me. They didn't know what the business was going to look like. Some of them aren't even from the healthcare industry. It's pretty incredible. Our team, I think, is one of our biggest strengths right now.
That's fantastic. So did you hire somebody to do the non-surgical treatments and you're just focused on surgery, or are you doing both of those yourself? And are you trying to bring on more providers?
Right now, I do 90% of the treatments. Well, one of non-surgical treatments, 100% of the surgeries. We have one fantastic nurse that is learning a lot of the non-surgical things. She has had a graduated kind of responsibility in our practice, and so is kind of ramping up in that way. She's a fantastic clinician. I think she has a very unique ability to listen to patients and get out of them kind of what their goals are and provide them a realistic treatment regimen. I think long term, we may have more patient or more team members that provide non surgical treatments. If you had asked me a couple of years ago, would I bring on another surgeon? I would say, yeah, maybe. But now, being a year and a half in, I don't know if I will or not because I love having the operating room to myself, not having to worry about the schedule. Like it's always open 100% of the time. It's fine. And not having to be on call for another surgeon if something comes up, because in the end, it's my building. For instance, the other day, this is a great like little learning opportunity, something that I never thought would have happened. The other day, we were notified by our front desk lady that, oh my gosh, one of your oxygen alarm panels was going off this afternoon. And I went back and checked, and all the oxygen tanks are reading 0. Well, this is a Monday afternoon, and I have a facelift scheduled on Tuesday, which is Tuesday morning, that's a big case. And so we were about 12 hours away from a surgery and we had no oxygen. And what had happened is there had been a small leak in our oxygen system, the pipes that bring the oxygen all the way to the operating room. And so at the last minute, I had to call our oxygen supplier and troubleshoot how to get all this figured out so that our patient could still have her surgery because she had taken off work and planned for all this. And so little things like that, it's okay because it's my patient and I'm dealing with it all. But had it been another surgeon's patient, that would have been even more stressful, I think, for me.
Oh, for sure. Are you doing everything under general, or what are your feelings now about doing some of this under local and twilight? Because the patients sure like that.
We offer a mix of options for patients. Straight local, I don't recommend for most things. We're working on the face, which it's kind of hard for a patient to find their Zen spot and kind of tune us out, right? It's not like I'm working on their toe. So just local, I don't recommend. We have our anesthesiologist, and she often talks to patients about kind of what they're wanting, what their comfortability level is. Most of our patients are done under a twilight sedation, very similar to a colonoscopy, where They're totally asleep. They have no memory or recollection of what's going on. They're not talking. They can't hear us do anything. But they don't have a breathing tube in, which helps them not feel like they've been hit by a truck the next day.
I love Twilight. Yeah.
Yes, in certain patients, or if patients have certain medical comorbidities, we may opt to go ahead and put a breathing tube in, but that's a discussion between our anesthesiologist and the patient. And I think safety is number one always. And so we have to go with what's safe, and then preference wise, what are we wanting for today?
So back to this 14 months where you're kind of sitting on your hands waiting for things to happen. What are you doing? Are you trying to market your practice, grow your social media? Like, what are you doing with that time? Because then when the doors open, you've got to go.
Yeah, definitely not sitting on my hands. There was a lot of construction oversight. So I was at the building every day talking. There were a lot of meetings with the architects, the builders, a lot of the subcontractors. Um, a lot of it was spent doing the surgery center licensing and talking with the state about different regulations that I had to follow and different rules that I had to have on the books. I was talking with different equipment companies, for example, buying an anesthesia machine. Rarely does a surgeon buy an anesthesia machine. So there's a lot of self education and research and talking with different companies and reps about which machine I should buy. Also, interviewing potential employees, vetting them, seeing if they would be a great fit. And during this whole process, you have to market yourself. I was a little reticent early on to put all this out on the internet because I was like, oh, well, they're clearly going to see I'm young. This is my first venture into business. It's my first time being on my own as a surgeon. I don't know if I really want to advertise that, but I did. And it was the best decision I made for my practice. People want a story, they want to know you, they want to know your why. And so putting myself out there, putting out the entire story of the construction, the buying equipment. I mean, some of my videos that went viral were as simple as me in sweatpants cleaning my surgery center, like before it's even open. Um, because I think it shows really who you are as a person. I think we as healthcare professionals tend to only want to portray ourselves in a quote unquote like professional or white coat way. But I think putting myself out there, showing all of the struggles that went along with opening my own business and just the kind of delays here and there, um, was what had me patients in the door on a wait list and ready to book surgery when I actually opened my doors. I mean, it was crazy. Our first month, I don't have the numbers right in front of me, but the first month that we reached out to people and said, okay, we're finally taking surgery consults, I already had a fairly hefty wait list of patients that said, when you're ready, for me, I'm going to be in for a consult. And that's why we were able to schedule a facelift within like 4 to 6 weeks of me opening the surgery center.
Nice. By the way, on social media, were you collecting names, emails, cell phones for that waiting list
On our website, we were, yes.
on the
And
website?
so, yes, on our website, to start out, you don't have to have a complicated website. You just need a landing page so that people can find you and know where your business is, a little bit about you, even if just one page on the internet, and then a kind of a area for them to put in their name, yeah, like you said, their email and cell phone number. And then that populated on the back end of my website. So I was able to keep all those secure. And then as soon as we opened the actual office and I started seeing non-surgical patients while we were waiting the surgery center licensing process. And so we updated all those surgery patients and said, hey, our clinic is open. We're starting to do things like Botox, skincare consults. Our surgery center is almost ready to go. We'll let you know as soon as we're ready. So the lines of communication were open that whole time.
Gotcha. So how long did it take for you? Like, how many days a week do you do surgery? And are you doing as much as you want, or is there lots of capacity there to do more?
So I would say for the last 12 months or so, we've been fairly average at one, what I would say, big case a week. big case being facelift plus maybe a couple extra things like eyelids or laser or a rhinoplasty. We are moving to 2 days a week starting next week, actually. And so the fact that we're doing 2 full surgery days a week and we're only a year and a half in is pretty mind blowing to me. I, yeah, it's just crazy. I am a surgeon that likes to do one big case a day and then maybe see a few clinic patients in the afternoon. I'm not somebody that wants to churn out 3 facelifts a day. That's just not me. I think most surgeons would agree that after one big case, your energy level ticks down a couple notches. And so I may never do, a full 8 hour case, full 8 hour caseload in the operating room. I may always do little like 4 to 6 hour days in the operating room and then see some afternoon clinic patients. That's kind of my ideal schedule. But I think for the next 12 months, doing 2 big cases a week is perfect. I think professionally, there's a lot of stress that goes along with operating on people's faces. And so I also, while I could physically maybe do 3 cases a week, I don't think professionally I'm ready for that jump in stress level.
So you're doing facelifts, but you look really young. Has that hindered you at all? Like, what, where are these patients coming from? And because they must be older, they must be in their 50s and 60s or more. It's just, it's amazing that they're, aren't they saying to you, you're not even old enough to be my like granddaughter, or daughter, you look really young.
A few thoughts. Thank you. I'm 35.
That's young.
Putting myself out on the internet really self-selects a lot of those patients. So patients know exactly who I am before they come in. And so patients that are wanting the opposite of me, an old male, they just don't even come to me, which I think is fine. It's just like looking up your Yelp restaurant before you even book your reservation. You kind of know what they offer and if you're interested in that. A lot of patients, as they should, ask about my experience, my caseload, my professional numbers, and I'm very open and honest with patients. I often will tell them, even if they don't ask, I say I'm a younger surgeon, which is good and bad. Younger surgeons arguably have less experience, but I also think that I'm, more on the kind of horizon of all the new techniques. A lot of patients are very educated when it comes to facelifting techniques. And so, one benefit of this younger generation of surgeons right now is that we've really only trained with the deep plane technique, which is now considered pretty much the gold standard with facelifts. And so, why an older surgeon will have definitely more numbers than us, they may not be as hungry to stay up on the latest and greatest innovations. I think some surgeons get old and bored and burned out, and that hunger for perfection and innovation and improvement starts to fizzle out.
I can see that happening for sure. So what are the struggles today? Growing a practice, there's nothing easy about that, but what's keeping you up most at night?
I worry. Well, okay. So the main thing that keeps me up at night is that I worry a lot about my patients. Just to be totally transparent, I'm sure there will be some patients that listen to this, and I think every young surgeon can commiserate. It's very stressful to operate on somebody, and I think especially in the world of aesthetics, there's not a clear black and white of, was the procedure done as good as it could have. It's not like a cancer surgery where we say we got the tumor out. Yes, check mark. It's, is the patient going to be happy with their result long term? And it's such a subjective area when it comes to cosmetic surgery. And so I try to set the bar at a very realistic level in our preoperative consultations. I oftentimes will show them before and afters of patients and point out tiny little things here and there that bother me about that particular patient long term. Now, the patient on the other side of the desk will say, oh, well, I didn't even notice that little bump or little thing there. And I say, well, when it's your face, you will notice that. And so I think the average patient coming in for some of the more routine procedures that we do, I tell them it's realistic for me to shoot for a 90% improvement in you. 90%, what does that mean? What is 90%? And so I often lay in bed awake thinking about, is the patient I did today going to be happy with her 90% improvement? And if not, the great thing is that we're able to do little tweaks and things long term. Um, and most patients are very um, open and appreciative of our team for offering that ability rather than us just saying like, oh, you're fine, go away. I tell the patient at the end of the day, your opinion is really the only one that matters because it's you that chose to do all this. I also worry a lot about my team. I worry that one day someone will quit.
They are going to, some of them will.
I already had somebody quit kind of last minute, and it was pretty crushing to me. I never thought that person would leave last minute and kind of leave me high and dry. I think for the first few months, I was really personally upset and kind of mad about it. But I think at the end of the day, we all do what we think is best for ourselves and our career. And so I just have to respect her for that decision. And I don't have any ill feelings now. I just, it's preparing me for the next person that will leave last minute. And I don't know. So yeah, I worry most about the people, the patients and our team.
When you say that's the biggest challenge of running a practice is the people, the staff, managing staff and then controlling patient expectations. It's all human beings involved,
Yes, the universe is unpredictable. And I think when I go to these meetings and listen to other people talk about their biggest challenges, I somehow have been very fortunate in the first year and a half. We have just such an amazing team. I really don't have a lot of the employee and staff struggles that I hear other offices talk about. And I don't know if it's just beginner's luck. But I also try to be as intentional about being an employer as I humanly can. And I'm in a couple different group chats of other surgeons, and commonly people will ask little things about here and there and employee this and employee that. And I try to just take a different approach, I think, than most offices. And I try to take the approach that I work for them. They don't work for me. And I think that makes you look at things a lot differently. It makes you have more gratitude for all of their work and dedication that they bring to the office every single day for your business. Nobody will ever care as much about your business as you do, and they shouldn't because it's not their business. Um, and so, if they can do things 80% right, that is a huge success in my mind. Do I nitpick on the 20%? No, I try not to. I think I look at it as an opportunity for education and improvement. Like I mentioned, we have some staff members that don't really have a healthcare background, which is, I think, one of their strengths, honestly. And so whenever there are little bumps, maybe in a phone call or a patient question that they answered, it's never, well, why didn't you say this? It's pointing the finger back at myself and saying, we haven't practiced that scenario enough. So they probably just weren't quite as prepared to answer that question as I thought they were.
Yeah, you've had very good luck with staff, but you got blindsided, and I think that happens a lot. And as a consultant, I always say just prepare for that. Just make sure you know everything. You have as much IP out of her head and get it on paper or get it into Loom videos or checklists or get all of that information somewhere centralized. So if somebody were to walk away without notice or, get ill or whatever, all that information isn't walking out the door. Someone's got to be able to pick up and take off where they left off. you know?
Yeah. And one way that I kind of practice that, I don't know if I've really relayed this to our employees, is that they have unlimited time off, and I really encourage them to take time off. And so, for that reason, other team members get to be our patient coordinator when our full-time patient coordinator is out. Other when our nurse is out, it helps the team member cross train by default. And so I think it's a good practice for if they do leave last minute, then the other folks are somewhat ready to fill in.
Yeah. But can you back up? What do you mean unlimited time off? What the heck does that mean?
I said I do things differently. Yeah.
Yeah. Like, what does that mean to the staff?
They can take as much time off as they want. Um, I also I'm proud to say I have a 12-week full paid maternity leave for employees.
All right. I understand that one. Unlimited. I just don't like, are there any boundaries around the unlimited? Are you saying they can come in when they feel like it or leave when they want? Or how?
So no, normal working days, our offices is generally about 9 to 5. So they come in a little bit before, and then they actually rotate. A lot of them will leave a little bit before 5, which I'm fine with. I don't think everybody needs to be there until 5 every night. And then they can schedule their vacations. Our patient coordinator scheduled a 2-week vacation to Thailand this December, and I encouraged her to do so. I think they care about our business a lot, not as much as me, but I don't think anybody's going to abuse it if you pick the right team member.
So, all right. So who takes the most time off? Like how many times has that person taken off? The one that takes advantage of this the most?
Nobody's overused it.
Well, like just for example, the person who has taken the time off, what are we talking here? They're just taking a couple days extra a year, or a couple weeks extra, a couple months extra.
Cumulatively, probably a couple weeks a year.
Okay. And is this paid time off?
Yes, paid time off.
Gotcha.
Full paid in full, as long as they're a full-time employee. Our part-time, we do have a couple part-time employees, and they're not offered quite the same benefits.
Okay. And is there some plan to like what's your vision for the future? Where are you going with all this?
I think in the perfect world, I would have a great work-life balance and be able to provide the treatments that I think are best for our patient population. It's a little bit hard to like crystal ball see what exactly that means. I think right now we are offering all of the treatments that I want to offer to patients in terms of facial, plastic surgery, cosmetic procedures, facelift, eye, eyelids, chin implant, fat grafting. Um, Non-surgically, we're offering the gamut of what I want to offer: neurotoxin, filler, laser, microneedling, and chemical peels. I think opportunities for growth would be bringing on an esthetician potentially to bring in that market of patients. And then I think expanding some of our non-surgical volume by bringing on another nurse. But like I mentioned earlier, I don't know if I'll ever bring on another surgeon for a surgery center. I think in the next 5 years, if I can pay off my loan and grow our team slowly but strongly, that's my main goal.
All right. Are you going to stay neck up, or are you going to get into like non-invasive body contouring, or you're just going to stay face?
Yeah, I named the business Face Leewood, and I really only have the desire to operate on the neck and up.
Gotcha. Back to social media, because I know you've been very active on that. Are you still? And if so, would you say a lot of your business is coming from that, or do you think it's local SEO that's working? Like, what's keeping you busy? Do you know?
TikTok.
Really? Wow. All right. How many hours a day are you spending on social?
It varies pretty significantly based on my day. In the world of cosmetics, we inevitably get cancellations, which is kind of a bummer. But in my mind, if a 1 hour surgery consult cancels, you should spend that hour promoting yourself online. The world of social media has opened the doors for businesses, and it's now essentially free advertising. It's like taking out a yellow page book years ago and not having to pay for your ad. Um, Currently, we're pretty active on TikTok, Instagram, and Facebook, and I've not really paid for any substantial amount of ads in any of those platforms. I've tested out maybe $50 here or there to see what that will give me.
Are you boosting posts or you're actually doing ads? And if so, is there a particular procedure that works better? I would think TikTok and rhinoplasty goes well together. Are you doing it that way?
Good question. On Facebook, we have run some independent facelift ads. For TikTok, if I have a post go viral, maybe a month later, I'll promote it with, throwing 20 or $30 at it to see if that really does anything. Instagram, I've not paid for any posts. I think it's a little bit of a misconception that TikTok is only for younger patients. We see a fair number of our facelift consults from TikTok, and I have had a fair number of traveling patients, believe it or not, as TikTok referrals. And I think TikTok has the great ability to expose you and your practice to patients that wouldn't have otherwise follow you. That's the whole unique concept of that platform. Whereas Instagram, you mainly have to follow someone before it'll show you their posts and stories. Um, TikTok is designed differently to where it shows you things that it thinks you may like based on your interests. And so I would say, I don't have the numbers in front of me. I would venture to say 50% of the facelifts I have done in the last year found me on TikTok.
Okay. And what about pay-per-click? Are you in that world or no?
No, I do my own website. It's like $30 a month on Squarespace. I've not paid for any like Google ad stuff. We are thinking about taking out a billboard in Kansas City with a big before and after. Dr. Mike Nyack is an incredible surgeon, mentor. And I went to one of his meetings a few years ago, and he had talked about how great the billboards worked for him in the St. Louis market. And so that is a hefty marketing expense, but I've essentially spent almost nothing on marketing for the last year and a half, which is crazy because social media has been so great.
Well, it can't hurt. Well, what can hurt is if you have to do a long-term contract and you're not happy the first month out and you have 11 to go. That, I would just say keep it short and tight just in case it doesn't work. But in your kind of area, Kansas City, are you near a big highway? Like with lots
Yeah,
of
there's lots of big highways in Kansas City. I'm on kind of the southern aspect of the greater Kansas City area. But it's still, I mean, it's not a huge city. So, and it's not like we're selling just Botox. People, when they're looking for their facelift surgeon, they are willing to drive. It's driving 30 minutes south or flying from another state is pretty common now.
So, what percentage are out of towners?
For surgery patients,
Mm-hmm.
I would say in the last few months, probably 25 to 30% of our surgery patients are out of towners.
See, I think that's so interesting because that's how the world has changed so much. If I had to put money on that, I'd say no one's going to fly to Kansas, but I would have said that about Nyack too. No one's going to St. Louis because I just assume everyone goes to Miami or LA. And it's not true. People go anywhere you want if they like you. So, I think all the rules have gone out the window. I do.
Yeah, and I think we just do things a lot differently. I think when you are slightly different than the market, you have to emphasize that. Dr. Nyack, for example, he's a phenomenal surgeon. And so that's what sets him apart from a lot of the surgeons in Miami and the other big cities. I'm obviously very young, but I'm also a female. And so I think I have to capitalize on that female component. Our building alone, if you just go on our website, there's a gorgeous video of our independent building that sets us apart. having a private standalone surgery center sets us apart. And so it's usually not just one reason that a patient will opt to go with you. It's usually multiple reasons that gives them the gut feeling that you are the right provider for them. We also recently instituted a post-surgical survey that we send our patients about a month after they've had their big surgery, just to get feedback. It's totally anonymous, so I can't see who said what, but universally, looking through the responses that we've received so far, it's communication. I think our office does such a great job communicating with patients from the minute they contact us about a potential consult to scheduling their consult to their actual surgery consult. Usually is about an hour and a half. They spend about an hour with me and then about 30 minutes with our patient coordinator. After the consult, we send them everything, in email format so they can review everything. The surgery scheduling process is very straightforward. Um, Before surgery, we meet with everybody 4 weeks before to answer any last minute questions, go over every little procedure again, do all our paperwork and payments. And there's so many communication step touch points within the whole process that I think patients are like, wow, this is different than when I had my tummy tuck at whoever else's office down the street. It's just totally different. But when we come to make big changes or institute new kind of steps with our patients, I always ask myself, like, what would I want done? I'm essentially the key demographic. I'm a female who's had cosmetic surgery myself, and I think I have a fairly good feel for what my patients are going to want, things that they don't want, things that seem excessive or overdone versus things that are just helpful and during the whole process that surgery is, because it's a big deal, for people to trust us with their care.
For sure. Can you just give us anything you care to share about the craziest staff or patient story that you have had so far?
Um, okay, crazy patient. This is probably more on me than the patient, but um, I would venture to say that a lot of great cosmetic surgeons by default will operate on patients that they very closely know or potentially related to, and they care about them very much, because it's not like getting your gallbladder out, like your friends or your family want to come to you because you think that you can provide them a great result and they think that you're the best. So maybe different than some other arenas of healthcare. Well, I recently dipped my foot into the pool of doing a case on a patient that is very near and dear to me. It was a little interesting operating on them. You kind of have a little bit more nerves or more butterflies in your stomach that morning, which, you already have some butterflies before every patient, at least at this point in my career. Maybe 10 years from now, I won't. I hope I still always do. But so I was a little bit more nervous. The case went perfectly. And I knew that the patient would be very particular based on their personality and their profession. They're now just about a week and a half out from surgery, and boy, they have proven to be kind of impatient about everything. And I don't think I shortchanged the whole consultation process in terms of the detailed expectation setting that I do for patients and talking to them about how long it takes to heal. You can't judge your results, a week and a half in. But even today, I was on the phone with them for 15 minutes, just kind of providing some reassurance about we are only a week and a half out. There is no way that you can judge your results. But I will say it makes me a little more hesitant to do other good friends and family in the future. I don't know. I'm sure you've known surgeons who've operated on close friends and family. What are your thoughts on all of that?
I would say the older ones do it more often than the younger ones because you're still, getting your legs under you. And, they used to say, you should never do surgery on your wife, but then again, I know so many who have done their wife's facelift 3 times. So I think you just have to know thyself. And frankly, you already have so much on your plate mentally. You don't need that extra aggravation. I just wouldn't do it right now. I would just wait until you're super comfortable, you know?
Yeah, so not a crazy patient, just an interesting learning point for me now being about a year and a half in and feeling, fairly comfortable with the more straightforward procedures, no like crazy revisions or anything like that. But even with the smaller, more straightforward cases, it's different operating on somebody that you very closely care about.
Well, you know what else? Again, you like this blindsided thing. You can do something that's so benign in your mind, and it becomes a big deal. It just becomes a whole thing because of the public. You're working with human beings, so that's the part I would just be prepared for anything that could happen. And I think you're crossing all your I's and dotting your T's, and you're doing everything right now. But there will be those hiccups that come by that just like, what? Where did that come from? So when it's all said and done, almost 2 years in, what would you have done differently, or what advice would you give others who are going down that same road you're going? Because it's very unusual for you to do what you did, like right out of fellowship, you went for it. Would you advise others to do that, or what do you think?
So I have two thoughts that pop into my mind when you ask that question. One is when you start to get upset about something, just walk away for about 10 minutes and come back. Because I think surgeons in general tend to be fairly impatient individuals. At least I know I am, and some of my good friends are. And so when little things come up, it's like, oh, this is such an inconvenience. I just want to fix it right now. But sometimes the best answer is to wait and think about it before you make a decision on certain things, especially when you're feeling more emotional about them or getting angry about something, which is probably just good life advice in general that I may be able to use outside the office as well. The other thought I had is that if you're gonna run your own business, you have to be a good troubleshooter. You know, drug shortages, you have to have multiple sources when it comes to getting your medications. Oxygen, when you run out of oxygen, you have to know how to troubleshoot your anesthesia machine so that you can hook your oxygen tank up to the back of it and not use the leaky pipe in the wall. Staffing, when somebody calls in sick, you have to be able to troubleshoot with your staff and ensure that they're cross trained enough to where you can still provide safe and effective care for your patients. Otherwise, you have to cancel the case, which may happen someday. It hasn't yet. So I'd say, on the days when you're feeling especially challenged, just get up from your computer and walk away before you make a decision or say something. And then with the day to day little hiccups or bumps in the road, have on your troubleshooting hat because that's what's going to make you better long term. And it's going to help you be a better boss and a better doctor for your patients. To answer your question of whether I would encourage people to do it, I am super glad I did it. I think that's kind of like the question when patients sit down for their surgery consult and they say, well, do you think it would be worth it? I'm like, well, I don't know. It's your face. I don't know how much this bothers you. I told you about all the risks and benefits and downtime. You have to tell me if it's going to be worth it to go through all of this. I think with opening a business, it's really hard to know if you're going to like it. I'm fortunate in that I really do. I find a lot of joy out of, having my own team and being able to provide the care that I want to provide to patients and taking my time with everybody. If I worked for a big group, I wouldn't be able to have an hour surgery consult with every patient. I would probably be limited on that. But that's what I want to do. And that's what we're doing. And we're paying our bills and we're growing 7.5% over last month. And so it's working. I think sometimes reinventing the wheel is worth it because it's better.
Mm. Last question. How are you doing all this and juggling the family at the same time? You have little kids, right?
Yes, I have two little boys. They're 2 and 5, and I am not really doing that well. I think a lot of people don't talk about this component of it, so I'm glad you are kind of closing with it.
I have a little dog that I'm trying to, he's very happy, and that's my level. I can keep him happy, but that's about it. Yeah.
I think I have to schedule time away from the office. For example, the holidays are coming up. You just have to block your days off. And could I make extra money and see more patients on certain days? Sure, but we're taking off Thanksgiving and Christmas and the kind of the surrounding or abutting days. And I have a wonderful spouse, but I cannot claim to have a great work-life balance because I often think about my patients, and then I often worry that I'm too busy with work and not home with my kids enough. So I don't know. I think it's a current challenge for me.
I just think life is challenging anyway, and that's just another piece to the puzzle. But congratulations. You're just doing a super great job. I'll be watching you grow your practice, and I'll see you again at some more meetings. And if somebody wanted to get a hold of you, how would they do so?
So message me on Instagram, message me on TikTok, message me on Facebook. I personally manage all of those. That's probably the easiest way. Just Lauren Umstattd. My last name is very unique. So any platform, I'm very easy to find.
Can you just spell your name? Because I struggle with it.
Okay. It took me about a year to learn how to spell after I got married. So it's Umstattd, like Tom, David. It's got a lot of consonants. It's not my husband's biggest strength, but he came with other great things besides the last name.
That's so funny. When I was growing up, or my best friend, her name was Deborah Shuffleberger, and she said the happiest day was when she got married to Thomas Brown, and she could be Brown instead of Shuffleberger. She said it was just brutal going through life with that name. So funny.
Yes, at work I go by Lauren. I don't need anybody to say my last name. It's a mouthful.
All right. Well, thank you so much, everyone. That's going to wrap it up for us for now for Beauty in the Biz. Thanks so much for listening. And if you haven't subscribed, please do so you don't miss any future episodes. And if you've got any questions for me, you can leave them on my website at katherinemaley.com, or you can certainly DM me at Instagram at katherinemaley.mba. Thanks so much, and we'll talk again soon. The fastest way to success is to model other successful surgeons who have what you want. But you can only see their results, not the path they took to get there. So you continue to jump from one thing to another, hoping to find something that will work for you too. But it rarely does. So try this shortcut instead. It's guaranteed to move you forward. I compiled my intellectual property to grow cosmetic revenues, everything I've gleaned over the years, into one playbook of the most successful practices and what they do to win. Go to cosmeticpracticevault.com and let's grow your cosmetic revenues.